Hi everybody, Dr. Duresti, Cranial Release Technique, back with another video. Excuse me. So I had an interesting case. I had a patient that came in complaining of right foot and right ankle pain recently into the office. 67-year-old lady in good shape, has had this pain for months, has been to podiatrist, orthopedist, has taken medication, has had injections, and someone recommended, why don't you try this chiropractor? He does something different, meaning me, and this thing called cranial release. So she came in, I checked her, spine was distorted, cranium was distorted. I did a few simple tests and I could easily tell that she was carrying more weight on that right leg. So it made sense to me that because that right leg and right foot and ankle were overworking, carrying extra weight, maybe that's the reason why it's giving her so much trouble. So I explained to her about the concept that the brain controls every function that we're aware of and not aware of. The brain is housed in the cranium, the 22 bones that make up the skull, the head, and that when these bones twist and shift, that puts mechanical tension on the brain, that distorts the spine and pelvis, and of course then that interferes with the what's called the primary respiratory mechanism, this involuntary excuse me, this involuntary breathing mechanism of the cranium. And so long story short, she was here last week. I asked her, how's the pain in the foot and ankle right now? She said it's probably about a 7 or 8 out of 10. Applied the cranial release, had her get up and walk. Within 2 minutes. How's the pain now? Maybe a 2 or 3. So how could that possibly be? Well, again, we're taking tension off the brain. What I like to say to keep it simple is when the brain is happy, the body's happy. When the body's happy, everything else works better. And that's the point. It's just optimal function. Cranial release is about optimal function. So if you're out there and you're a practitioner and you'd like to learn more about this, you can visit the website. That's cranialrelease.com. If you'd like to learn how to actually apply the technique, you can take a look at that on the website. There's a button called Online Training Program. You just click on that. That'll take you to the training program to see how you can learn this work from me in the comfort of your home or office. And if you're a potential patient out there, regardless of where you are in the world, take a look at cranialrelease.com. There's a button, Find a Practitioner, and hopefully we'll have someone in your area. All right, so you can't get too much farther from the cranium than the ankle, and I didn't touch her leg or foot or pelvis or anything. I applied the cranial release technique here, and I let the body do what it does, and within a minute or two, she felt the difference. Now, when she comes back, I'm going to check her again, and she's going to have another CRT, the cranial release technique, also known as CRT. It's something that should be done on a regular basis to optimize function, regardless of if you have aches or pains or dysfunction. We want to optimize central nervous system function, and that's what this is all about. This is Dr. Duresti saying have a wonderful day, everybody. I'll see you next time. Be well. Adios. For now.